So we're talking about integumentary assessment. We're going to talk now about edema. So if your patient has swelling, you need to know where that's located. You need to know what type of edema it is. Is it pitting? Is it non-pitting? Is this edema from an injury that's localized? Is this edema from CHF that's going to be more generalized, or it's going to be in dependent areas? Is this ascites? So what type of edema it is? Where is it located? Is there any discoloration associated with the edema? So is there bruising? Is there modeling of the skin if the patient has maybe some CHF or some fluid overload? And is there any tenderness with that edematous tissue? You also need to be able to assess skin lesions. So we're going to look at some views of this, but you can also see images of most of these skin lesion types in your assessment textbook. Okay, so we're going to go through some types of lesions. First of all, we're going to look at a macule. A macule is a non-palpable skin color change. So we have permanent macules like freckles, but we may also have macules that are part of a disease process like Petrachiae, or like the macular rash of measles. So let's look at an image of some macules. This looks like a macular rash. These macules are not raised. Now, there are some rashes that begin with macules, they're not raised, and then through the course of the infection, they become raised, and then they become papules. That would be a maculopapular rash. So I'm going to switch next to papules. A papule is a palpable solid elevation. So we can have a palpable nevus. So some people have a mole that's palpable. This is a palpable solid elevation that looks like it might be a whitehead, or in the process of maybe it's an impacted pore, but there's a palpable solid elevation. Okay. Sorry, trying to get it off the screen. I need to go to the next screen. So next we're going to look at a nodule. A nodule is palpable. It's deeper than a papule. A papule is on the surface of the skin. A nodule is deeper. It's firmer. It's 1 or 2 centimeters. An example of that might be a wart. This is actually a nodule just below the eye that is ulcerated. Okay, so this is a nodule with an ulcer at the top of it. Let's go to the next. Next is a vesicle. Vesicles are fluid-filled blisters. So think of a blister. Think of the fluid-filled vesicles we see with chicken pox, or this actually looks like probably shingles. And you can actually see there's a couple of pustules here too. It's a vesicle if it's filled with clear, usually clear fluid. Usually doesn't have, a vesicle doesn't have pus, but if it develops pus, then it is a pustule. So this is an example of a pustule that looks like it's an ingrown hair. A tumor is a larger solid mass. This is an example of a type of tumor. This is a lipoma, but a tumor is a larger solid mass. A wheal is a palpable area of skin edema. So think of a mosquito bite or hives. You can see this is just an area of edematous skin, and you can actually palpate that raised skin. Atrophy is when tissue is not getting adequate perfusion. This looks like an area of atrophied skin after an injury of some type. You may also see atrophied skin similar to this on lower extremities if someone has arterial insufficiency. So you see the skin is much thinner than the surrounding skin. It's very smooth. It might be shiny and translucent appearing. That's atrophied skin. We're going to look now at a skin erosion. Erosion is when the epidermis is lost and there's generally no bleeding. A ruptured blister, ruptured vesicle will cause this erosion. We may see this erosion sometimes with maceration when the tissue has been so been wet long enough that some of that epidermis is lost. So this is erosion. A crust is dried serum or blood or pus or a combination of that on the surface of the skin. Frequently, it's covering an ulcer or a lesion of some kind. So think about that scab. These look like crusted, these look like crusted, possibly herpetic lesions. Could be a bacterial infection, but they look a little bit like herpes lesions, like cold sores to me. So, and those will crust as part of the process of that infection. Scales are flakes of skin. In some diseases like eczema or psoriasis, the skin is damaged and so it flakes off. This is psoriasis, so it has these thick flakes of skin on the top. Those are called scales. A fissure is a crack in the skin. This is an image of a heel with several fissures. Okay, those are linear cracks. They can actually open up at the base and become a site for infection. An ulcer is a deeper loss of the epidermis and the dermis. They may bleed and they may scar, and they may be just the epidermis and dermis, or they may actually get much deeper. So these are ulcers. Have to switch the pictures in a weird way for them to show up for you. Spider angioma is, this is an arterial change. And so this is going to be red, has a red center with radiating red legs. These are not harmful in themselves. They can be indicators of some disease processes, but they're not really uncommon and quite a few people have them. A cherry angioma is it's a vascular lesion that's red and round. It looks like a cherry, and it possibly is raised. And again, these are not uncommon. Sometimes if these are bumped or hit, they're disrupted, they may bleed some. Spider veins are bluish lesions with those radiating legs that maybe look like spiders. So you saw the spider angioma that's red. Spider veins are connected to veins rather than arteries, and so they're more bluish, and they're common in patients who have some venous insufficiency or some excess venous pressure. Okay, now we're going to look at petrachiae. Petrachiae are pinpoint, they're little dots that it's actually pinpoint bleeding below the surface, just below the surface of the skin. So they're not palpable, they're just little red dots. And petrachiae can be from certain types of injury, especially a squeezing injury. Some patients, especially if they have very fragile veins or fragile skin. When you put a blood pressure cuff on them, they may have some petechiae under that. I had a child that used to get petechiae across his face from coughing or vomiting. But petechiae can also indicate a bleeding disorder. So this is something that should always be evaluated. Okay, so petechiae are little pinpoint hemorrhages. Purpura are larger areas of bleeding under the epidermis. These are senile purpura that are not uncommon in elders, but there are some other causes of purpura that can be problematic. So purpura are larger areas of bleeding under the epidermis. We're almost done. Now we have bruises. Okay, bruises are either ecchymosis or they're hematomas. An ecchymosis is a non-palpable bruise, so that you have visible bruising in this picture. Looks like maybe a fall. She has visible bruising. But if you can palpate the bruise, it is a hematoma. So let's look at one. And of course we can't palpate because it's a picture, but it looks like this might have a pretty good knot under it. If you can feel this knot, that's called a hematoma. That's a palpable bruise. The other thing I want to include in this section are just the changes that you expect with aging skin. So when you're assessing your patient, as we age, our skin gets thinner. Okay, we lose elasticity, so we're more likely to see bruising and skin tears. And when we lose that elasticity, that's when we have some wrinkles. Skin is drier and flakier as we age. It tears more easily. Hair tends to thin. The nails get thicker, but they grow more slowly. We have decreased oil and sweat production. We may have uneven pigmentation. We may have slower healing. And there's less subcutaneous tissue over bony prominences. And those things actually increase the risk of skin breakdown for our older patients. Okay, we're going to come back in the next section. We're going to talk about skin healing. So what happens when there's an injury to skin.